I'm Janice. I'm going to be your nurse for today. And I'm here to do an assessment. Is that correct?
Yes, ma'am.
Okay. And I'm going to be doing an assessment on your head, face, eyes, ear, nose, throat, and mouth. So, what is your name and your age?
Jaquan, and I'm 17.
Alright. So let me perform hand hygiene. And you can just relax. This here assessment isn't going to be painful. I may ask you a few questions, and I may have to touch. I do have to touch and palpate. So just let me know if any areas are tender or sore. But this will not be a painful assessment. I'm going to apply my gloves. And one thing that I'll be doing is inspecting and palpating, and I'll use a pen light also. I'm pretty sure you're familiar with it. So first off, I'm looking at your hair and your head. So your head is normal. I don't notice anything that's abnormal here. Head is round and your hair is full. Your scalp is not dry. I don't notice any dandruff or any lesions or sores. The color is dark brown. It's two-tone, so it's like a dark brown and a light brown honey blonde. And do you feel any pain while I palpate or apply light pressure to your scalp?
No, ma'am.
Okay. Next, I'm going to be looking at your facial area, and your face is symmetrical. I don't notice any drooping, any lesions, or any drainage. Everything is symmetrical. Your eyes and ears are symmetrical. Your nose and your lips are midline. And I don't notice any drainage or abrasion. So I'm going to also test your facial nerve, which is cranial nerve 7. And what that is allowing you to kind of notice if there is facial drooping, or for us to notice. So could you smile and frown? Frown, okay. And then can you put some air in your cheeks? I'm going to apply pressure to both sides, and the air kind of escaped out equally, so that's normal. Also, I want you to close your eyes tightly. I'm going to try to lift your eyes and just close them tightly. Okay, so that muscle is normal. The strength of it is normal. And let's see. My next assessment is going to be your trigeminal nerve, which is cranial nerve 5. And I'm going to palpate gently on the temporal artery, and I do feel it. And then I'm going to place my hands at the temporal mandibular joint, where I need you to open and close your mouth. Alright, and is there any pain or soreness as you open and close? Alright. So, next I'm going to look at your nose. Your nose, like I said, is midline, it's symmetric, it's normal. I'm going to push up on your nose, and the septum is normal. There's no soreness. I don't notice any drainage or any abnormal lesions or discharges coming out there. And your membranes are pink and moist. I don't notice any dryness or nasal polyps. So can you apply one finger to one nostril, and inhale and exhale, breathe in and out, and then to the next one. And I hear clear patency. I don't hear any congestion, so that's normal. I notice you have an ear ring, a nose ring in your ear. Okay, my next assessment is going to be with your eyes, and I don't notice any drainage. I'm looking at your eyes. The sclera is white and it's moist. Like I don't notice any eye trash or any things that's in your eyes, any thing that's going to cause infection. Your pupils are dark, black, dark brown, and then the iris around it is dark brown. So I'm going to shine this light to the side and just look straight ahead. I'm looking at the cornea, and it is non-concave, so it's circular. And another thing that I'm going to ask you to do is just look at my pen. Here I'm going to be testing your cranial nerves 3, 4, and 6, which is the ocular, the trochlear, and the abducens. So when you look at my pen, just follow along, and I'm going to go diagonal. Okay. And then outward. And then down. And all of those are intact. Now I want you to kind of look distant straight ahead for me. And I'm just going to be looking, I'm going to shine the eye just to see if your pupils constrict. So just look normal, and it's going to be a brief light in your eye. Okay, I did see that one constrict. Okay, I did see that one constrict. And so the pupils are equal, round, reactive to light and accommodation. All right, so that light kind of when you see some light, it kind of goes from light to dark, so it could possibly have your eyes water because you have to adjust to it. So that was normal. Did you notice any pain, or do you have any blurry vision as I do that? Okay.
No.
So now I'm going to be testing your hearing. And one other thing, let me see. Let me test cranial nerve 2, which is the optic. And could you read this for me?
Strawberry.
Okay, so that's intact. And I would like for you to close your eyes for me. I'm going to test, this is your cranial nerve 1, which is olfactory. And what is it?
The candle.
Well, I wanted you to close your eyes and smell it to tell me what it smelled like. So, but that's what it was, the olfactory. So what scent did you smell?
That's caramel.
Okay, so that's normal. That's a caramel vanilla. So my next one is to test the cranial nerve 8, which is the acoustic, the hearing. So I'm just going to first look at your ears, and your ears, like I said before, are symmetrical. I don't notice any abrasions or no dry skin. It's normal. I'm going to just touch and feel. Let me know if you feel any tenderness. That feels okay. Alrighty. And I'm going to test the hearing. So could you hold this ear, and I'm going to whisper something, and just let me know what you hear when I whisper.
Basketball.
Okay, and press the other one.
Football.
Okay, so that is intact. That nerve is okay. I didn't, like I said, everything seems normal. My next one is to palpate your lymph nodes, okay? So I'm going to be using circular motions in some area, but right on the chin, I'll use one hand. And I think I did do I need to do your sinuses. So after I check for your lobes, I'll go and do the frontal sinuses and maxillary sinuses. So I'll label the nodes as I go. We have the preauricular lymph node, preauricular, and then postauricular, posterior auricular. We have occipital. I'm using circular motions, occipital. Then we have the submental. Then I have the submandibular. And then the jugulodigastric. Okay. Superior cervical. And lean your head that way. Superior cervical. Okay. And then we have the deep cervical chain. the deep cervical chain. And I'm not feeling any lymph nodes that are like swollen or no lumps or anything. And then I have the posterior. So the posterior cervical. And then the subclavicular. And I didn't notice, like I said, I didn't notice any enlargements. You didn't feel any tenderness as I was palpating the lymph nodes. And next I'm going to palpate to test your sinuses just to make sure that there's no pressure here. This is the frontal sinuses below and above the eyebrow, and then below the cheekbone is the maxillary or the maxillary sinus. Alright. So next I'm gonna do your oral. Okay. So I'm gonna look at your lips. Just say there were no cracks on your lips. Lips are moist and pink. No lesions. Say I for me over your mouth and lift your tongue. Okay, and I see veins. Everything is moist. Teeth are all lined up and intact. You can put your tongue down for me. Open your mouth and stick your tongue out. Move it left to right. That's the hypoglossal. And that's cranial nerve. That's good. That's cranial nerve number 12. And stick your tongue out. Say I for me. I'm looking for the uvula. Okay. I'm looking for the uvula. And I see the uvula that rises and as you say, okay, that's good. And it's moist pink. Your tongue is just the normal color. Your lips, like I just looked at it, everything is normal, pink and brown for your skin tone. If we are African American, so the gum line, it will be pink and kind of darkish purple pink. So that's normal. I didn't notice any sores, no loose teeth or anything. And then let's test the cranial nerve, which is cranial nerve number 9, where it's your mouth. I want you to say, cranial nerve number 12, hypoglossal. Say light, tight, and dynamite.
Light, tight, dynamite.
Okay, that's good. So that's in test. Now, for the mouth, that's the, when I asked you to say we were testing the vagus, which is cranial nerve number 10. And I'm not going to use, at the doctor's office, they use the little stick to go in your mouth and push down your tongue to see if you have a gag reflex. We're going to skip that part. We did notice for the mouth, like I said, you lifted your tongue, you did left and right, you said you were able to open and close your mouth, and there was no pain. I'm going to come around and I'm going to check your thyroid, okay? And as I did your lymph nodes, let me back up. Look at your neck, lift your head for me. I'm just feeling for the trachea. Trachea is normal. Have this notch here, and it's equal on both sides. Equal on both sides. And I see everything is midline, it's circular. I don't notice it misplaced or anything, so that's normal. And I'm going to come to the back. I'm going to gently put my hands behind your head. And right here, I'm just feeling for the thyroid gland. And you don't have an enlargement or anything, so it won't be noticeable. But can you lower your head a little bit and then try to swallow, or just swallow? And there, I feel it. And that there, when you feel it, that's the thyroid gland, and it can move left to right. So I do feel that. And it's even, it's centered, it's no pain. Like I said, I won't be able to say to listen for anything because nothing is abnormally large. So I think that's it with the assessment. I checked everything, did your hearing, your vision, your hair, your head, everything was symmetrical. I didn't notice any lumps, bumps, bruises, lesions, discharges, or drainages. Okay, thank you. Okay, giving a shift report to my oncoming nurse. Did an assessment on Jaquan, a 17-year-old male. He came in for a head, face, eyes, ear, nose, and throat assessment. His head was normal cephalic. It was normal. No abnormalities, no deformities. Hair color was dark brown and light brown. Full head of hair, no alopecia, no discharge, lumps, lesions, dandruff. Everything was normal. The skull was the appropriate shape for the body size. Facial extremities were intact. Everything was normal. Eyes, ears, and were symmetrical. Nose and lips were midline. It was in the center. It was appropriate. No facial drooping. Skin tone was clear and even. No sores. No nothing abnormal noticed or observed. The eyes, the pupils were equal, round, and reactive to light and accommodation. The sclera was white. The iris was dark brown, and the pupils were black. The cornea was non-concave, and the conjunctiva was pink. I didn't notice any drainage, no pink eye, conjunctivitis, no abnormalities with the eyes. Was able to pass the cranial nerve 2 optic vision test. No enlarged sinuses, no pain or tenderness on the frontal and maxillary sinuses. I did palpate the temporal artery and the temporal mandibular joint was intact, was able to open and close mouth without pain, and did not complain of headache or soreness there. Nose, the septum was not deviated, it was normal. I didn't notice any nasal polyps. He had clear patency. Was able to press down on both nostrils, one at a time, and inhale and exhale. I also noted that his nose and the inner was moist, so I didn't notice any dryness, no scales, and no discharge from the nose. Mouth and oral, no sores on the lips. The mouth was not dry. He was hydrated. I didn't notice any sores, any lesions, no. It wasn't asymmetrical. His lips were symmetrical. It was normal. He was able to smile and frown. He was able to puff out the cheeks as I applied and pushed on both sides, and air did equally escape. Cranial nerve 12 was intact. He was able to stick his tongue out, moving from left to right. He was able to say light, tight, and dynamite. And his he was able to open the mouth, say ah, and uvula was present. Was able to, his uvula did rise. I didn't notice any swelling of the tonsils. It was pink in color. Like I said, moist. And his teeth were intact. Gums were pink and purple for his culture, his African American color. And what else? I didn't notice any soreness. Hard palate and soft palate were present. Moist. Didn't notice any lesions there. And he was able to swallow. I was able to palpate and feel the trachea. I was able to feel the thyroid. Nothing was, everything was midline and centered. No pain upon swallowing or me palpating. No enlargement of the thyroid. Lymph nodes were all normal. Nothing was non-tender. And let's see, hearing. He was able to hear and he was able to correctly repeat what I said. The tragus and the oracle were not tender or sore. And he was able to follow command upon me asking him to like hold one ear down and repeat what I said as the whisper test. And I think that's all. Swallow that. Like I said, the thyroid was not enlarged. And he was able to swallow, which was cranial nerve 10, the vagus 12, the hypoglossal. He was able to stick his tongue out, and he did pass the smell test, cranial nerve 1. And that's my report on a 17-year-old male.